Hey everyone, and welcome to another deep dive. Today we're going to be focusing on a truly captivating case study.
Oh, yeah.
In feline neurology. And
I love these.
yeah, you and me both. So we're looking at a report from the Journal of Feline Medicine and Surgery Open Reports about a 4-year-old Scottish fold cat.
Okay.
And this cat had really unusual neurological symptoms. Like think circling, stumbling, not your typical catnap behavior, right? Definitely a puzzling presentation.
Yeah.
And, you know, this cat wasn't just dealing with neurological signs, but also had a history of osteochondral dysplasia.
Oh, wow.
You know, that bone and cartilage disorder, common in Scottish colds.
Yeah.
The poor thing had even been treated for potential joint pain before things took this turn.
So right off the bat, the vets had a challenge.
Yeah.
You know, was this a new problem or was this an extension of the existing bone and cartilage issues? The initial list of possibilities was long.
Oh, wow.
I mean, metabolic or infectious diseases, trauma, maybe even a tumor or a vascular issue.
Yeah.
To get a clearer picture, they turned to MRI.
Right.
And that's where things got really interesting.
Okay, so MRI time.
Yeah.
And this is where we start to see some really striking abnormalities.
Right.
And not just in the brain, but also impacting the skull and muscles.
So the MRI revealed a mass within the brain itself.
Okay.
Specifically in the right piriform lobe, there was thickening and contrast enhancement of the meninges.
Okay.
The membranes surrounding the brain and spinal cord.
Right.
Plus signs of swelling and pressure like edema in the white matter and herniation in different parts of the brain.
Hold on. There's more.
Oh, there's more.
The MRI also shows something called syringomyelia.
Yeah.
Which is a fluid-filled cavity within the spinal cord.
Okay.
And get this severe bone degradation in the skull, particularly in the right frontotemporal area.
Yeah.
On top of that, there was swelling and contrast enhancement in the right temporal muscle. This wasn't just a brain issue. This is a whole get-a-get situation.
You're catching all the important details and seeing those findings on the MRI definitely narrowed the focus.
Okay.
Now, neoplasia, the fancy term for abnormal tissue growth, often a tumor, became the primary suspect.
Yeah.
Histiocytic sarcoma, T-cell lymphoma, aggressive meningioma, even glioma.
Wow.
All had to be considered.
So a lot of possibilities.
Yeah.
But all pointing towards something serious.
Right.
Other things, like a fungal infection, became less likely.
Yeah.
Based on the cat's history and what the MRI was showing.
Right. But to get a definitive diagnosis, they needed more information.
Okay.
So they used ultrasound guidance to take fine needle aspirates, basically tiny samples, from the right temporal muscle and the right parotid lymph node.
Okay, so time for cytology to shine.
Yeah.
What did those samples reveal?
The findings were pretty telling.
Okay.
Under the microscope.
Yeah.
There were these round to oval cells with pale blue cytoplasm and distinct oval nuclei with coarse chromatin.
Right.
Some of these cells were even engulfing red blood cells.
Interesting.
A process called erythrophagocytosis.
Yeah.
And there were some precursor cells of the erythropoietic series, you know, the ones that develop into red blood cells.
Okay.
Along with a few megalocytes, large red blood cell precursors. All of these features pointed toward histiocytic sarcoma, or HS.
So HS, that's a cancer originating from histiocytes, which are like the immune system's cleanup crew.
Yeah.
Supposed to gobble up bacteria and cellular debris, not become cancerous.
You've got it. And the cytology also confirmed that the HS had spread to the lymph node, indicating a disseminated form of the disease.
Disseminated meaning it wasn't confined to one spot, but had spread to other areas.
Yeah.
This was not looking good for this poor kitty.
Unfortunately, you're right.
Yeah.
Disseminated HS is a tougher opponent than localized HS.
Okay.
While localized HS tends to stick to soft tissues like the skin or muscle, disseminated HS can affect multiple organ systems.
Which explains why this cat was dealing with such a wide range of symptoms.
Yeah.
Neurological problems, bone destruction, muscle involvement. It was all connected.
Yeah, it was.
Now, I know HS in the central nervous system is rare in cats.
Yeah.
Is there a reason why?
That's a great question.
Yeah.
And one that researchers are still exploring.
Okay.
It might have something to do with the blood-brain barrier,
right,
which acts like a protective shield around the brain and spinal cord, making it harder for abnormal cells to get in.
Yeah.
But as we see in this case, sometimes those defenses can be breached.
Right. Interesting.
Yeah. And when those defenses are breached,
Right.
the consequences can be significant.
Yeah.
This case really illustrates how HS can affect different parts of the nervous system, leading to a complex mix of neurological issues.
This case is full of twists and turns. You mentioned that the MRI findings were pretty typical for HS in the brain.
Right.
But there was something unique about this case, right?
Remember that severe bone destruction in the skull?
Right.
And the involvement of the temporal muscle?
Yeah.
That's a novel finding in feline HS.
Wow.
We haven't seen anything quite like it before.
That's incredible and a little bit alarming.
Yeah.
So this cat wasn't just rewriting its own health story.
Right.
It was rewriting the textbook on feline HS.
Yeah.
It makes you wonder, could this be more common than we realize?
Right.
And are we missing it in other cats?
That's the burning question.
Yeah.
This case really highlights the importance of considering HS. Even when we see unusual features, it broadens our understanding of how this disease can present.
It also raises a question about how the tumor caused such aggressive bone loss.
Right.
Was it directly invading the bone, releasing enzymes that break down bone tissue, or just pressing on the bone and causing it to wear away?
Those are all possibilities.
Yeah.
And without a post-mortem examination, it's tough to say for sure.
Yeah.
The same goes for the muscle involvement.
Okay.
Was it a primary muscle tumor? Or did the HS spread from the brain to the muscle?
Yeah.
It's a bit of a medical mystery.
A mystery that this deep dive is helping us unravel.
Yeah.
Speaking of unraveling mysteries, this case also showcases the power of cytology in making a diagnosis.
Totally. Cytology was key here.
Yeah.
It provided a definitive diagnosis of HS,
Right.
even though histopathology,
Right.
the gold standard, which involves examining tissue samples under a microscope, wasn't performed.
So cytology really stepped up to the plate.
It did.
And it's interesting that they didn't use immunocytochemistry to further confirm the diagnosis.
They mentioned that there wasn't enough sample material to do that.
Right.
But the cytology results, along with the MRI findings, painted a clear enough picture to make a confident diagnosis.
A clear, but unfortunately not a happy picture.
Right.
Based on this grim diagnosis and the cat's declining condition, the owners decided to euthanize their pet.
Yeah.
It's a heartbreaking situation, but it really shows how complex these cases can be.
It does. It reminds us that we need to be constantly learning and evolving our diagnostic approaches.
Yeah.
It also underscores the importance of advanced imaging techniques like MRI.
Right.
Imagine trying to figure this out without those detailed images of the brain, skull, and surrounding tissues.
It would have been like navigating a maze in the dark.
Yeah.
But let's shift gears a bit and delve deeper into histiocytic sarcoma itself.
Okay.
What exactly are histiocytes?
Yeah.
And why are they so important in the body?
Great question. Histiocytes are specialized immune cells that belong to a family called phagocytes, which literally means eating cells. Right. Their main job is to engulf and destroy invaders, like bacteria and viruses, as well as cellular debris. They're like the body's diligent janitors, keeping things clean and tidy.
So they're essential for a healthy immune system.
Absolutely.
But when these histiocytes become cancerous, that's when we see histiocytic sarcoma, right?
Exactly. In HS, these normally helpful cells go rogue and start multiplying uncontrollably, forming tumors and potentially spreading throughout the body.
And we talked about how there are two main types of HS, localized and disseminated.
Right.
What's the difference?
Yeah.
And why is that distinction so important?
Localized HS, as you might guess, is confined to a single area. Often starting in soft tissues like the skin muscle or under the skin. It can be locally invasive, but it generally doesn't spread to distant organs.
So it's more of a contained threat.
Yeah.
But disseminated HS is a whole different ballgame.
Right. Disseminated HS is more aggressive.
Yeah.
The cancerous cells spread to multiple organ systems.
Right.
The spleen, liver, lungs, bone marrow, lymph nodes, and as we saw in this case, even the central nervous system.
Which explains why this cat was experiencing such a diverse range of symptoms.
Right.
It was like a domino effect with the cancer impacting multiple parts of the body.
Precisely. The disseminated nature of the disease creates a much more complex clinical picture.
Yeah.
And unfortunately, often comes with a less favorable prognosis.
So while localized HS can sometimes be treated successfully.
Right.
Disseminated HS presents a much bigger challenge.
That's generally the case.
Yeah.
The widespread nature of the disease
Right.
makes it tougher to manage and treat.
And you mentioned earlier that HS, affecting the central nervous system,
Yeah.
is quite rare in cats.
Uh-huh.
Is there a reason for that?
That's a question that continues to intrigue researchers.
Okay.
The blood-brain barrier likely plays a role.
Mm-hmm.
It's a remarkable defense mechanism
Right.
that shields the brain and spinal cord from harmful substances
Yeah.
and stray cells, including potentially cancerous ones.
So like a fortress wall protecting the brain.
Yeah,
But sometimes those defenses can be breached, as we saw in this case.
exactly. And when that happens,
Yeah.
it can lead to a cascade of neurological problems.
This case report does a great job of illustrating
Yeah.
the complexities of diagnosing CNSHS in cats,
Yeah.
especially given its rarity and the variability in how it can present.
You're right. It underscores the importance of staying vigilant
Right.
and considering all possibilities when we
Yeah.
see unusual neurological symptoms in our feline patients.
And this case really threw us a curveball
It did.
with that aggressive bone destruction in the skull
Yeah,
and the involvement of the temporal muscle.
right.
You mentioned that those findings were completely new in feline HS, right?
That's right. They were the unexpected twist in this case.
Okay.
Those unusual features initially made it even more challenging
Yeah.
to pin down a definitive diagnosis.
So the MRI findings pointed toward HS,
Uh-huh.
but the bone and muscle involvement added a whole new layer of complexity.
It did.
It raises questions about the origin of the tumor and how it spread.
Right.
Was it a brain tumor that spread outward?
Yeah.
Or did it start elsewhere and invade the skull and muscle?
Those are important questions, and without a postmortem examination,
Right.
you can't definitively answer them.
Yeah.
This case leaves us with some intriguing unanswered questions.
It's like a detective novel with a few missing pages.
Yeah.
But even with those unanswered questions,
Right.
this case adds significantly to our understanding of the potential ways HS can manifest in cats.
Absolutely.
Mm-hmm.
It highlights the variability of the disease and reminds us to keep an open mind when diagnosing complex cases.
Yeah,
There's always something new to learn.
that's a great point. Every case,
Yeah.
even the heartbreaking ones, contributes valuable insights to veterinary medicine.
Absolutely.
Like each case adds another piece to the puzzle,
Yeah.
helping us understand these diseases better
Yeah.
and improve how we care for animals.
Yeah.
It's amazing how much we can learn from a single case, even a sad one.
It really is. And this case also highlights the importance of collaboration,
Right.
between different veterinary specialties.
Yeah.
You have the neurologists interpreting those intricate MRI findings, the oncologists considering the different types of tumors,
Right.
the pathologists analyzing those cytology samples.
Yeah.
It's a team effort.
A true multidisciplinary approach.
Yeah,
It takes a village to tackle these complex cases.
exactly. And it's not just about the different specialties. It's also about the communication between the veterinary team and the pet owner.
Yeah.
Those difficult decisions,
Right.
like whether to pursue further diagnostics
Mm-hmm.
or consider euthanasia,
Yeah.
have to be made together
Right.
with open and honest conversations.
Couldn't agree more.
Yeah.
It's about finding the best path forward for the patient,
Yeah.
taking into account both the medical facts
Mm-hmm.
and the pet owner's wishes.
Right.
Now, this case report also does a nice job of contrasting
Yeah.
cytology with histopathology.
Mm-hmm.
We know histopathology,
Right.
examining actual tissue samples,
Yeah.
is considered the gold standard for diagnosing HS.
Right.
But it wasn't done in this case, right?
That's right. The owners opted not to pursue a postmortem examination.
Okay.
But the authors of the report highlight that intraoperative cytology, especially using the smear technique, can be a really valuable alternative.
They even cited a study where this technique successfully diagnosed CNSHS
Right.
in a group of dogs and one cat.
Very promising. It suggests that in situations where histopathology isn't feasible, cytology can provide that crucial diagnostic information,
Yeah.
allowing vets to make informed treatment decisions more quickly.
Which can be a game changer, especially when time is of the essence.
Absolutely.
It's incredible how veterinary medicine is constantly finding new ways
Yeah,
to diagnose and treat these challenging conditions.
it really is. This case is a testament to that progress.
Yeah.
While it's a sad story, it offers invaluable insights into feline HS and underscores the ongoing advancements in veterinary diagnostics.
So much to learn from this deep dive.
Yeah.
We've explored the ins and outs of this case, the unusual neurological signs, the twists and turns of the diagnostic process,
Right.
the surprising findings on MRI and cytology, and the intricacies of histiocytic sarcoma itself.
Right.
But what really sticks with me is how much this single case can teach us about a rare and complex disease.
Me too. It underscores the need for continued research into rare diseases like HS. Right.
The more we understand, the better equipped we'll be to develop more effective treatments and improve the lives of animals facing these conditions.
That's the crux of the matter.
It is.
Cases like this fuel progress in veterinary medicine.
Yeah.
Even if the outcome for this particular cat was heartbreaking.
It's a powerful reminder that we're always learning.
Right.
Always striving to expand our knowledge and improve how we care for our animal patients.
Well said. And to our listeners, this case serves as a poignant example of the complexities of animal health.
Yeah.
If your furry friend starts acting out of character, don't hesitate to seek veterinary attention.
Please?
Early detection and diagnosis can make all the difference, especially with potentially serious conditions.
Absolutely.
Yeah.
And don't be afraid to ask your veterinarian questions. The more you understand about your pet's health, the more empowered you are to make informed decisions about their care.
Such great advice. Well, this deep dive has been an eye-opening journey.
It has.
Into feline neurology. I'm always inspired by the dedication and skill of veterinary professionals who are constantly pushing the boundaries of animal health.
It's a field filled with passionate individuals who are driven by their love for animals and a commitment to providing the highest quality care.
That dedication is truly remarkable. A huge shout out to all the veterinary professionals out there making a difference every day. And to our listeners, thank you for joining us on this deep dive into the fascinating world of veterinary neurology.
From Vet Neurojar.
Yes.
Keep those minds-inspired hearts light and tails wagging.